Hi, my name is Erika Connor. I'm one of the dietitians at Stanford Cancer Center. I'm happy to be able to share the video about managing side effects with you today. I hope you find this video and the others in this series helpful. Let's get started. Welcome to part 2 of nutrition side effects during cancer treatment. The objectives of today's class session are to learn about the different common side effects that may arise during cancer treatment related to the digestive system. Learn about strategies to help alleviate those side effects. You have heard this before, and it's very true that every patient is different with their cancer treatment course. An individualized assessment may need to be done to best address your specific needs. What works for you may not work well for someone else, and vice versa. But you won't know until you try. Some of the common nutrition-related side effects we will talk about today are loss of appetite, nausea, vomiting, diarrhea, constipation, and gas and bloating. Appetite changes are extremely common and can occur due to several different treatment courses, including surgery, chemotherapy or immunotherapy, or radiation, specifically to the head and neck areas or to the digestive tract. Appetite can also be affected by other medications or even due to other challenges like constipation or nausea. Here are some tips if you lose your appetite and eating becomes very challenging. It is really important to implement what tips you can to avoid losing muscle. Eat by the clock, which means try to eat on a schedule, even setting an alarm or timer to remind you to eat at certain times. Snack between meals, which means graze through the day. Enjoy. Large meals are almost impossible when you don't have an appetite. In order to meet your needs through the day, small pit stops work well. Shakes can be helpful here along with combination snacks like peanut butter and an apple or whole grain crackers. Fix several portions of meals or snacks so you have things readily available day to day. Freeze foods in smaller portions so these items are easy to defrost and eat. People tend to avoid larger frozen items like lasagna or a large container of soup out of fear of wasting it once it's defrosted. Make food visually appealing. Add garnishes and seasonings to jazz things up. Colors are always helpful. Distractions can be helpful at taking the anxiety and stress off of needing to eat when you don't feel like it. Watch TV or read a book while you eat, or eat with others. There are several appetite stimulant options, so please talk to your team about these options that might be best for you to try. An increase in appetite can also happen. This is most common when a steroid like Decadron or dexamethasone is part of your treatment course. However, so many people respond differently to so many aspects of treatment. Here are some tips to help control calories to prevent unwanted weight gain. Listen to your body. Are you truly hungry? Or are you angry, frustrated, sad, tired? Practice mindful eating, which means that being aware of what you are eating, how much, how fast, and how you feel overall. Drink calorie-free beverages like water to avoid unwanted calories. Flavor your water with a hint of flavor instead of drinking juices or sugary drinks. Use tea bags or fruit in your water. Pick lean proteins and low-fat or non-fat items to help reduce calorie intake. It's important to get proteins throughout the day to help you feel satisfied. Eat plenty of fiber from vegetables, fruits, and whole grains to help you feel satisfied and for a longer period throughout the day. Cut back on sugar foods and drinks like sodas, juices, certain yogurts, and some condiments. Nausea and vomiting can be some of the most challenging side effects during treatment. I cannot stress enough that it is so important to communicate with your team about how you're feeling. Anti-nausea medications are part of most treatment protocols. If you are taking a medication that's not working for you, it's important to tell your team so they can try something else. Here are some helpful tips for nausea. Eat small, more frequent meals. Choose some more bland foods, easy to digest. Some saltine crackers, rice, oatmeal, soft cooked chicken, eggs, banana, unsweetened applesauce. Avoid strong odors. Foods that are cool or at room temperature are best and less smelly. Ventilate the eating environment. Open a window or eat outside if it's nice. Avoid or limit rich foods like fried or greasy items or very sugary foods. Stay well hydrated. Sip on clear liquids, maybe some Gatorade, coconut water, broth, ginger tea. Control constipation. Constipation can worsen nausea and decreased appetite. And also be aware that not eating can sometimes make nausea worse or bring it on altogether. Vomiting may follow nausea and be brought on by treatment or food odors. If vomiting is severe and lasts for more than a day, contact your doctor and team. Visualization and relaxation exercises can help. Try tiny amounts of clear liquids like water or broth, apple or cranberry juice, fruit ices without fruit pieces, Pedialyte pops, maybe some ginger ale or 7-Up or Sprite. Begin with 1 teaspoon every 10 minutes, gradually increasing the amount to 1 tablespoon every 20 minutes, and then try 2 tablespoons every 30 minutes or as tolerated. Once these liquids are tolerated, try a softer diet with bland foods, such as mashed potatoes, rice, pureed fruits, yogurt, or toast. Drink and eat more potassium and magnesium-rich foods as able. Potassium-rich foods include coconut water, bananas, potatoes, oranges, tomatoes, apricots. Magnesium-rich foods include peanut butter and grains. Diarrhea has many causes. You may get it from the disease itself, from surgery to your digestive system, chemotherapy, radiation treatments to the lower abdomen, or from the use of antibiotics. It can develop because of an intolerance to milk or difficulty absorbing fats. It is important to communicate with your team as diarrhea can lead to dehydration. Here are several tips to help control diarrhea. Eat small, frequent meals. Drink fluids after every bout of diarrhea. The more diarrhea you're having, the more important it is to focus on fluids like coconut water, Gatorade, liquid IV, or drip drop, broth, or soups. Try the brat diet, or also called the white diet. Bananas, rice, applesauce, white toast, skinless chicken, white fish, egg whites, soft tofu, cottage cheese, smooth yogurt, canned or peeled peaches or pears. Avoid any food, candy, or gum with sorbitol, xylitol, or mannitol, or other OL sugar substitutes. This can make diarrhea worse and can cause gas and bloating. Avoid greasy, creamy, or fatty foods. Drink or eat foods higher in sodium to help replace sodium losses. These can include broth, soups, crackers, pretzels. Avoid raw vegetables and unpeeled fruits with skins and seeds until diarrhea subsides. Sit or lay slightly reclined for 20 to 30 minutes after a meal to help slow digestion. Besides adjusting food and fluid intake, there are some other strategies to be aware of for this challenging side effect. There is certainly a time and a place for medication. Using Imodium or Lomotil often together, can bring much needed relief. In some cases, digestive enzymes can be helpful, but it is important to talk to your team about this option. Some other non-medications that can help manage diarrhea include small amounts of fiber like psyllium or guar gum, kudzu root powder, or chia seeds. Tips to manage constipation are similar in ways to help diarrhea. Eat smaller, more frequent meals, as larger meals are just not realistic or comfortable. Make sure you're drinking enough fluids. 8 to 10 8-ounce glasses or cups are often needed. Warmer fluids are more bowel stimulating. Warm water is often effective at moving bowels, but you can also add in some lemon juice or a decaf tea bag. Decaf coffee is also okay. Another trick is to drink prune juice at room temperature or slightly warm. Gradually increase fiber intake by including various fruits, vegetables, soaked beans, which helps reduce gas, bran, or other whole grains. Movement or activity of any kind is crucial. Do laps around the house if you have a hard time walking outside. Talk to your team about the safe use of stool softeners, laxatives, and fiber supplements. And just a few more tips for constipation. Often diet alone is not enough to get your bowels moving. Please speak with your medical team regarding medication options and use of laxative teas. Often the first step involves the addition of a stool softener like docusate sodium or Colace, and mild laxative like Senna or Miralax. This recipe has been used in nursing homes for many years and is effective and safe for constipation. Gas is a normal part of digestion. However, if it is excessive, it can lead to unwanted belching or flatus. Bloating or trapped air may occur when gas collects and remains in the body, which can be very uncomfortable and often painful. Reduce or eliminate the following foods to see if you can get some relief from excessive gas and bloating: beans, lentils, quinoa, and gas-producing vegetables like broccoli, cauliflower, Brussels sprouts, cabbage, and onions may need to be temporarily limited. Fried or fatty foods. Sugar substitutes with sugar alcohols like mannitol, sorbitol, xylitol in most sugar-free candies and chewing gum, but also in a variety of sugar-free products. Carbonated drinks. Lactose-containing foods like milk, ice cream, yogurt, and cheese. Thank you very much. I hope you have found this very helpful.